Hi, myself Dr. Anuj Maheshwari. I am Vice President of RSSDI. I am Governor of American College of Physicians India chapter as well as Secretary General of Indian Society of Hypertension. I am Professor of Medicine in Hind Institute of the Medical Sciences at Lucknow. I am here invited as a faculty in RSSDI Annual Conference Chennai 2022, and my topic has been here: what are the recent advances in the diagnosis of hypertension. Under this topic, I had discussed the changes which has occurred in the diagnosis of hypertension in recent times. The first and foremost change has occurred: the cutoff for the diagnosis of hypertension has been reduced to what earlier it was. Earlier we thought that 140/90 was the cutoff of hypertension, and we have been establishing it by number of evidences. But now the current evidences suggest that 130/80 should be the cutoff for the diagnosis of hypertension, not only for the diabetes patient but also for non-diabetic patient. For the diabetes patient, it is also suggested that we should not go beyond 120 mm of mercury. Means the range is very short, that is between 120 to 130 mm of mercury for the systolic blood pressure. For the diastolic blood pressure, almost all recommendations are agreeing to keep it less than 80 mm of mercury in all age groups as well as in all comorbidities situation. So this is the cutoff at which we can reduce the number of ischemic heart disease as well as strokes and cerebrovascular accident at their minimum. Apart from that, now the sphygmomanometer of which was earlier used with the mercury are not in use. They are all have been outdated and they are not recommended to continue with our practice. So what is the way through which we can measure the blood pressure? We can measure the blood pressure by the automated oscillometric blood pressure monitor. Apart from that, ambulatory blood pressure monitoring has been discovered a good and reliable method of blood pressure monitoring. As far as diabetes is concerned, it is a disease which is having lot of variability in the blood pressure. Apart from that, this is a disease which is associated with the non-dipping of blood pressure in night time, or we call it nocturnal hypertension. Because of what many a times blood pressure rise in the night time is missed if we are measuring the blood pressure in our office or we are measuring the blood pressure through the home blood pressure monitoring only. Ambulatory blood pressure monitoring becomes mandatory in such diabetic patients, those who may be associated with some autonomic dysfunction. That's why it is recommended to use in all patients, those who are having diabetes and also may be on the verge of developing hypertension, or even they are non-hypertensive. Still it is very much recommended to check their blood pressure in the night time if it is not falling, because many a times it happens that blood pressure is keeping normotensive but it is not falling in the night time. Fall in the blood pressure up to 10 to 20% in the night time is required, mandatory as well as normal. If it is not there, then person is more prone to get the adverse cardiovascular outcome, cardiovascular disease or stroke and cerebrovascular disease. So keeping all these things in mind, keep your blood pressure less than 130/80, continue doing the blood pressure monitoring, especially with the home blood pressure monitoring. If you are having diabetes, then you must ask your doctor to go with ambulatory blood pressure monitoring. In the condition, if you are finding non-dipping status in your blood pressure in night time, then you must go for the specific treatment for the autonomic dysfunction, which can best be told by the clinician who is treating you. Thank you very much.